What pancreatic risk factors do regular checkups screen for? Imagine catching a health issue early before it becomes serious. That's what regular checkups aim to do for pancreas health and pancreatic cancer. During these visits, doctors look for specific risk factors that can increase the chance of developing pancreatic cancer. These risk factors fall into categories like genetics, medical history, and lifestyle choices, helping guide decisions about further screening or prevention. One of the most important factors is family history. If a close relative such as a parent, sibling, or child has had pancreatic cancer, your risk is higher. Doctors may recommend genetic testing if there's a history of inherited conditions linked to pancreatic cancer. These include mutations in genes like BRCA1 and BRCA2, which are also associated with breast and ovarian cancers, or syndromes like Lynch syndrome and Peutz-Jeghers syndrome. Genetic counseling can help determine if testing is right for you and what steps to take next. Diabetes is another key factor. Both long-standing and new-onset diabetes in adults have been linked to increased pancreatic cancer risk. During routine checkups, blood tests like fasting blood glucose or hemoglobin A1 degrees Celsius are used to monitor blood sugar levels. If you develop new or worsening diabetes, your doctor might consider it an early warning sign, prompting closer observation. Chronic pancreatitis, which is long-term inflammation of the pancreas often caused by heavy alcohol use or other factors, also raises the risk. Your medical history and symptoms related to pancreatitis are reviewed during regular visits. Managing and monitoring this condition can be crucial in reducing future risks. Lifestyle choices play a significant role too. Smoking cigarettes or cigars is a well-established risk factor. Excessive alcohol consumption, obesity especially with a body mass index over 40, and poor diet are linked to higher risk. During checkups, your healthcare provider will discuss these habits and may suggest lifestyle changes to lower your chances of developing pancreatic issues. Age is a natural factor. Most pancreatic cancers are diagnosed after age 65, and the risk increases with age starting around 45. Certain demographic groups, like men and African Americans, also have slightly higher risks, possibly due to differences in risk factor prevalence. When it comes to screening methods, for those at high risk, doctors might use blood tests to measure tumor markers like Ca19-9, though this isn't recommended for everyone because it can give false alarms. Imaging tests such as magnetic resonance imaging or endoscopic ultrasound can help detect early pancreatic changes in high-risk individuals. Genetic testing and counseling are also valuable tools for those with significant family histories or inherited risks. Monitoring new-onset diabetes is important too, as it can sometimes be an early sign of pancreatic problems. It's important to remember that routine screening for pancreatic cancer isn't recommended for the general population because the disease is relatively rare, and screening can sometimes lead to unnecessary procedures. Instead, screening is focused on those with significant risk factors, especially genetic or family history. Lifestyle factors like smoking, obesity, and diabetes increase risk but are part of overall health management rather than screening criteria on their own. In summary, regular health checkups help identify risk factors for pancreatic cancer by assessing family history, genetic predisposition, diabetes status, history of pancreatitis, lifestyle habits, and demographic factors. For those at high risk, additional testing and monitoring can be vital in catching issues early and improving outcomes. Always consult with healthcare professionals for personalized advice and appropriate screening strategies tailored to your individual health profile.